Welcome to It's Meseidy, honest conversations for freedom-minded women. I'm your host, Meseidy, founder of Libertas Sisters, and every episode I invite a guest to discuss topics such as femininity, relationships, the culture war, self-reliance, politics, and freedom. And let's be honest, whatever else I'm in the mood for. So pop in those headphones, pour yourself a beverage, and settle in. Let's get this episode started. Today, I want to welcome Bree from Spice Free Latte. She is an emergency room tech based out of Southern California. And I wanted to invite you on because I was following your story, and I know you've been confronted with a choice that many have been confronted with. As of this recording, it's September 30th, the last day for many healthcare workers and others to be vaccinated or lose their employment. I wanted to give you an opportunity to share your story of working in healthcare through the pandemic and the process of coming to the choice that you ultimately made. So Bree, go ahead and briefly introduce yourself and take us back to the start of the pandemic. And what was your experience and the general mindset within the healthcare industry at that time?
Sure. So thanks for having me on. My name is Bree. I am an emergency room technician, like you said. I think going back in time, it seems like all a blur at this point, but going back...
It does feel like eons ago, doesn't it?
It does. I have some documentation in my phone that kind of freshens my memory up, but yeah, it seems like forever ago. But going back to March 2020, I think the end of the month is when it all kind of shut down. It was really scary, definitely. I think everybody was scared at home and at work. Especially those 2 weeks, those first 2 weeks to flatten the curve, you know?
So, I don't know. I laugh every time I hear that, which is sad.
I know, because it's like, irony. Okay, only 2 weeks. Right. So that was a really scary time. I think everybody was just scared for the family, scared for themselves, scared to go to work even. We all, I think, fell victim of the media and the uncertainty that they were broadcasting to all of us. So it was a bit of a panic, I'd say, for those 2 weeks. And then the months to follow, I can confidently say people came to work and overcame all of the obstacles in their home life to show up for work and be there. And things were ever changing, you know, simple mask, N95, aerosolized procedure, non-aerosolized procedure, you know, full PPE, PAPRs, everything was very different. And we all really came together and adapted. You know, every single day we have safety briefings in the morning, and right now they're probably like 5 minutes, but in the thick of it, they were sometimes up to like 20 minutes because you really had to know what was going on that day, where they thought the virus was, all the things. So it was a very, really like homey feeling. It was like home away from home. A lot of us kind of joked that without going to work, we would just be like, I don't know. We would just be really, really scared. Everyone was isolated, but we had work.
Yeah. You had something to distract you during that time. So you couldn't really spend time thinking about what I was trapped. I don't want to say trapped because I'm a little dramatic. I was trapped in Texas. I actually live in Tennessee, but because my husband travels a lot for business and during that time he had to be in Texas, we packed up the dogs and everything and drove to Texas because we didn't know if things were going to get shut down, if he was going to be able to travel, if we were going to end up separated. I wasn't able to keep myself busy because I was just in an unfamiliar, I knew Texas. I used to live there, but it wasn't my home. It wasn't my space. It was out of my routine. And there was just a lot of not knowing. But I do remember during that time that there was a lot of talk about what was happening with healthcare workers and the sacrifices that they were making and how they were working really long hours. Did you feel like that was something not only from the general public, but something that was received with your own coworkers stuff, that you had this mindset of this is kind of freaky, but this is our duty and this is what we need to do in order to get through this?
Absolutely. Yeah. I think people go into healthcare because they're public servants, right? So we're there to serve the public. We have a job to do. We, are willfully employed there. So that's what we're going to do. And I don't think that it was a perfect distraction. Like, this is my job. This is what I want to do. This is, my life right now. And I am happy to be at work.
And there was a lot of reports in regards to shortage. And this is just a curiosity question on my own part, but did you see anything in regards to shortages in the hospital that of things, masks or things that were needed or being overwhelmed? And of course, your hospital and where you work is just a small microcosm of different areas where it affected differently. But I'm just curious about your own experience and where you work.
Yeah, we definitely had shortages. I think, I don't know. I don't want to say, don't quote me. I'm on a podcast, but don't quote me. I think it was after summer where we really started experiencing some shortages because there was like that Thanksgiving time surge, and we're still experiencing shortages today. So, whether it's like gloves or masks or whatever, we were reusing N95s for a little bit. And then we had tons of N95s. Then we had a different type of N95. And then it was simple masks. And then it was like, you can wear a pepper. So that was just really part of the ever changing
landscape of the entire thing.
Yeah.
So then my next question would be, there was like this camaraderie or this idea of, we need to get through this. We're a team. Everybody's supporting the healthcare workers. You see all kinds of stuff. I was about to make a commentary on the TikToks and stuff like that you would see, but let me not get
do it. Make it. No, do it.
You got nurses dancing on TikTok. You got, and
you did
and everything and just all of this celebration. But did you start to sense like a shift in the wind as the time progressed and the vaccine started to roll out? When did you start noticing that? And now granted, there was talk about the vaccine before the election on whether or not it can be trusted because Trump was in office. And so there was people that were like, well, we can't trust it because it's Trump. And then of course he loses the election. And now we're supposed to trust it implicitly. But have you sensed anything like a shift with your coworkers as like, we're in it together and now there's becoming tension depending on where you stand in regards to quote unquote resolve the pandemic?
Yeah, totally. But I just want to rewind a little bit to the nursing TikTok.
Okay.
I can honestly say I never made that. TikTok is not my platform of choice. However, I know that the nurses face a lot of backlash on that, but I think it's very important to note that all of summer, I, for one, gained 20 pounds during the summertime while at work because our hospitals were not our hospitals. I work at one hospital. My hospital was very empty and the community had really gathered around and was giving us food. When I tell you I didn't bring my lunch to work for the entire summer, I'm not joking. I had pizza and sandwiches and sweet treats almost every single shift. And I am so grateful. But it went on for so long during that summer that towards the end of the summer, we all started to feel guilty. Most of us, I don't want to use these definite terms. A lot of us felt guilty because we weren't doing anything. We were doing nothing. Like, you're our heroes. We love you. Thank you so much. And they were feeding us. And the community, the love and the support was absolutely amazing. But we simply were not working because people were afraid to come into the emergency room. So we had very little patients. People were being sent home. There was definitely not a staffing shortage by any means because we didn't have nearly as many patients. There was one time I worked in the emergency room, we had 0 patients.
Okay.
I work in San Diego. Like, that's crazy. So the TikTok videos, was it right? Was it wrong? I don't know. That's for you to decide.
At first it was like, I thought it was kind of silly that they were being called out or whatever, because I saw it as an exercise to blow off steam. You know what I mean? Because the situation was kind of stressful. But as it progressed, and it's interesting that you share that, because when you look at it from the outside and you're just watching it in the news and you don't know any better or whatever, you're being told that, oh, they're so busy, but then they're putting out these videos. So, but again, we can have this discussion maybe someday, but what was the cause of that portrayal? Is it because the media was trying to freak us out and scare us?
Fear-based.
And then
propaganda,
exactly,
for sure.
And the truth wasn't actually coming out from the people who needed to, voice, who were making TikTok videos, because they weren't actually as busy as being told. And that's not to say that there weren't other areas or hospitals that got overwhelmed.
Sure.
But
right. Like New York and stuff.
Yeah, exactly. But it's just like what starts to get shared on social media are the nurses who have time to make a TikTok. And then it's the correlation of assuming that oh, they have time to do it, but they're telling us they're so overwhelmed when, I don't know, one group of nurses might be in the middle of Idaho and the ones that are overwhelmed are in downtown New York. You know what I mean?
Yeah. It was just this blanket belief, that was thrown out on everyone's television and news feeds. And it was, like you said, people were busy for sure. And those people were definitely not making TikTok videos. They were like peppered up and doing all the things and doing their job, which they love, So there's two sides to the story for sure. But I just kind of wanted to share my experience with that.
And I'm glad you did, because I hadn't really even thought about it much past that. Like, it was just something that I popped into my head and I flippantly made a comment about it. But now, like, this is why these conversations are good to have, because you get perspectives that you don't think about because you're not in that space.
Yeah. And I'm not defending them. And if people were doing that when they weren't, when they had patients that were, needing their assistance, obviously that's a problem. But in my experience, that was not the case. So I think the transition, So I think a lot of people forget that, Trump really spearheaded the warp speed, right? He wanted the vaccine out. That was his whole thing. So people seem to forget that. I didn't really think anything of it. So I'm not an anti-vaxxer. I don't get the flu shot, but I'm all vaccinated. But he did that. And it was here, they had the whole tiers. I don't know if it was every state, but I'm not sure. But in California, we were tier 1 for the healthcare. And so I think I could have.
Yeah, they did it here in Tennessee too, where it was like if you were a healthcare worker, and then I think it was like dependent on your age and
sure.
And
yeah.
Like that.
Your risk factors. Okay. So I think I could have gotten my first shot as early as Christmas Eve, or maybe a little bit earlier than that. And I just didn't want to do it. People were doing it and they were talking about these crazy symptoms, and I don't really ever get sick, honestly. And they were talking about these symptoms and, when you get your first shot, make sure you have the next 2 days off. And it was just like this whole thing. And I was like, that's so weird, So I wasn't bought in from the beginning, honestly. But it was not anything. Nobody really said anything. Nobody really cared. It was just like a choice that you made. And I remember going into the new year because we could make appointments. I had made an appointment. I think it was on like January 7th, I think was my appointment to get my first shot. And I was like, you know what, I'm just going to make the farthest out appointment I possibly can, because I could obviously get it at work and see how I feel. Just like think about it, but have something.
Well, and then also give yourself an opportunity to see how other people dealt with it. I mean, that's kind of been my strategy, is that it's not, again, also, I grew up in the military. They vaccinate their children. You know what I mean? Like, they're very liberal with vaccination as a dependent or being in the military,
Yeah.
So, and I don't have any issue with it either, but with anything, I am never, even, this is going to be a really ridiculous comparison, but for the last 10 years, I've worked in social media in some aspect or online. And everybody's like always really quick to jump on the bandwagon with a new ad agency or a new social media platform or a new program or whatever. And with everything, and I'm just kind of correlating this with something very simple, I'm always someone that sits back and waits to see something new, you know what I mean? And see how it kind of works out. And that's been my mentality with this, as opposed to like, people are trying to redefine anyone that has the smallest bit of skepticism, and not even skepticism, but just being like, I just kind of want to see what happens, which isn't a hard no, but they're being portrayed as like a blanket anti-vaxxer, as if you're against vaccinations in general.
Yeah. I'm for choice.
Yeah.
I'm like, that's, do what you want to do what's best for you. I love and support it, So I think that I obviously did not go to the appointment. Cut to the chase. I didn't go. I was observing other people like you do, and seeing what they were saying. And they really started to normalize these symptoms. I think my intuition was like, initially, this is strange. And then once the normalization of these off the wall symptoms, like, oh, I got my first shot and I was like down, I had the chills and I had a fever and I couldn't get out of bed. And I was like, skirt, what? Like, how are you even, I felt like I was living in the Twilight Zone, because it was like not talking about what you did over the weekend. It was literally talking about your post-vaccine symptoms and being like, oh, well, I didn't have that. Oh, well, I had this. Well, my husband had this. Oh my, it was
it's
just
like a weird,
it's so strange.
Yeah. It's a weird comparison of like battle wounds. You know what I mean?
Yeah.
To see who had a more significant experience or something like that, as if it's something like a badge of honor kind of situation.
Yeah.
Which was totally what we were being sold between like the selfies and the whatever, you know what I mean?
Sure. Yeah. Yeah. And that was the thing too, is they were posting it and I'm like, this is so strange. And I don't watch the news. I get all my, news from the internet, obviously, but it was like that. Like people would go around and they would sit at the chair and like, hey, let's go get our shot together. You take a picture of me. I take a picture of you. Like, here's my card. It was this whole very, very weird thing. So it just wasn't my jam. And so I just didn't get it. And then we'll actually rewind just a couple of days before my appointment. They were actually, so at my job, you'd have to go to employee health to get the shot, which is just like a 7-minute walk. But at my job, they were walking around with vials of it. And it was like, hey, have you got your vaccine? Have you not gotten it? Like, we can just do it right here because there was so much extra and they didn't want to waste it because
it goes bad, right? Or I don't know if bad's the right
think
word,
so.
But yeah. Because I know there have been stories where a portion of a vial is used. Of course, I do not know.
No, you're on the right track. Yeah.
Yeah. But that like a portion of a vial is used and that some is left over and you have an official interaction in person event
by a certain date
to have it by a certain, and use it by a certain date.
Yep.
But there have been reports of people being like, it's going to go to waste and then using it on someone who's not authorized to get vaccinated, whatever that means, and then getting in trouble for it.
Yeah. So that was also like another red flag. I was like, I can't believe they're walking around with this. No. So weird. Again, it's so weird. So I would just politely declined, and nobody asked me why. Nobody, I think it was just really safe to say, and bringing in race into the conversation if you want to. I mean, I'm a Black woman in the healthcare field and, it's my duty, as a Black woman to pave the way and be an example. So I think it was just a very clear, false assumption. Like, oh, Bree, she totally got it, like whatever. And I was just like, oh, no, thanks.
I've been told I present white is one of my favorite things that people like to say to me because I'm Puerto Rican. And in the food blogging community, I'm known as like the Puerto Rican food blogger, but then also I get like called out for not being Puerto Rican enough. And then not representing, not fitting the mold that is expected when you're a woman and of Latin descent. And you're expected to follow a certain narrative. And I'm like, or maybe I just think for myself. Imagine that much.
Yeah. Kind of weird, but
imagine it happens. We are capable.
Exactly.
I'm just kind of like, So I've actually been asked that because I've had a small online presence for a while and have managed to stay under the radar. And I've had people ask me, with your opinions, how do you stay under the radar in being online? I was like, I really don't know. Either people don't care about me enough or they assume things about me.
They assume they're programmed to scroll. I mean, I get so many assumptions on my Instagram. It's really been eye-opening because there's a lot of assumptions. Like at my job, I'm like this Black woman who voted for Joe Biden, and got the vaccine and she loves healthcare. And then online, I'm this like nurse on the front lines and all this type of stuff. And it's like, neither are actually true, So it's just all of these assumptions that I think is part of social media. That's a discussion.
Yeah, it's one of the side effects of social media for sure. Would you say there was a time that it started to be an issue? Like people started to notice what you were choosing?
No, it's crazy. I feel like I have I don't know. It's crazy. So that was in January, worked the whole spring. On summer, my boyfriend and I went on a 30-day road trip, not vaccinated. I was gone the whole time. I came back because first of all, I would like to say I'm a huge advocate of mental health. So I'm definitely that person who has like 0 PTO, 0 sick time. I'm using all of the things. And I've been very, very mindful of that this entire pandemic. So I have not overworked myself at all. So we took this trip And I came back like 5 weeks later and I'd be like, oh, where were you? Like, did you have COVID? And I was like, no, I didn't have COVID. I just was like
on vacation,
on a road trip. I was on vacation, And so since I've been back, I think we came back the beginning of August. I would say that's when I really started to notice, because I really missed most of summer at the hospital because I was on vacation. So in August is when I noticed it, because at that point, the vaccine is available to everybody. So before it was tier 1 and tier 2 and tier 3, and then it's kids. And so now it's like, hey, if you want to get it, go get it. And if you haven't gotten it, what's your problem? So last month in August is really when I started noticing the division. And, the chitter chatter at work from people who are like, oh, this person's COVID positive, but they didn't get the vaccine and that kind of thing. And I think it'd probably be safe to say that currently, as of right now, people at my job probably do believe that I'm vaccinated. I really keep my mouth closed there because it's a very liberal
well, you're in California, you're in San Diego, and a lot of times like admire that, because regardless of you maybe staying quiet at work, you're still very vocal on your social media and your platform. Of course, people have to find you in order to know that,
Right.
So it's not that you're hiding, but not all of us have to, what's the word I'm looking for? Have to be an activist in every space that we're in. You know what I mean?
Yeah.
Like you just kind of want to go to work.
And that's it, and that's it. And I thought about it for a while because I was like, this is a really great platform to be at my job and be a quote unquote activist. And I kind of, get my feet wet every now and then here and there. I even did so with like the election and Biden and Trump, and I was kind of getting my feet wet. But it's just one of those places. My job, unfortunately, is a place where people aren't willing to have open conversations. There's a right or a wrong, and I'm there for 12 hours. So I don't want to, dedicate my shift to this dead end argument. There have been a couple of people though that like, no, I've got my feet wet, and they're like, oh yeah, and we have these great conversations. Some people that are vaccinated, some people that are like raging liberals, but we're able to chat. But it's not something that I go.
You don't go looking for it, and you don't like hold a sign or a t-shirt or whatever to kind of trigger anyone.
Yeah. But
I'm putting trigger in quotes because that's annoying in of itself.
Yeah. But so today is, the D-Day as we talked about. And I think that if for some reason I'm not fired, I'm going to be an activist starting tomorrow, like literally, because
like vocalizing in your workplace.
Straight up, because something that really helped propel that is I actually got COVID. Okay. So I got COVID this month. So I worked on September 10th, went to work because I'm not vaccinated. Oh, I also did not submit an exemption.
Yeah.
So I had until the end of August to submit a religious or medical exemption. I chose not to do that because I think it's a bunch of shenanigans. I think it's them just holding something over your head. They told me that like they could ask for another one. And it was just like, I don't have any medical reason.
It's interesting that you bring that up. And I don't want to get sidetracked for too much, but at the beginning, when there was all this discussion about mandates, there was also discussion about like fake cards to, you know what I mean? And then, and I started to think about it, and then also the exemptions and everything. And granted, I am not knocking anyone who submits an exemption because I've
helped so many people do it.
Yeah, that is a good way to keep your job and still defend. Yeah, exactly. But also at the same time, at the core, the principle is it's medical freedom, right? To not be forced to do something that you don't want to do. So it also gives me now I'm in a position that I don't have to. So I'm speaking freely when I really don't have quote any right to speak. But my thought is like, I don't want to even feed into the perception of complying.
Yeah, that's me.
Yeah.
I've been silent. I've been a silent activist, if you will. So I was like, I'm not doing that. Mm-hmm. I'm like simply not doing that. I don't care. I'm not jumping through that hoop, not my jam. And then I have until today, September 30th, to file an exemption. I always call it an exception because I feel like it's better that way. But today to be fully vaccinated. So I've done neither, obviously. but I have to test at work, obviously. So I went into work on September 10th. I tested in the morning before my shift, or, at the beginning of my shift. I tested negative, and we had a huge influx of COVID patients. I'm not even going to lie. I don't know if they were vaccinated, unvaccinated. There was like a demented COVID positive patient.
Licking doorknobs everywhere.
Yeah. It was the most COVIDiest day of my life, literally. And I remember me and a coworker were like bedside with a patient, and we were like, she was all, have you gotten COVID yet? And I was like, no. And she's like, I think today's the day. And I was like, I think so. And I must have changed my scrub like 2 or 3 times that day. So that was September 10th. My son broke his arm and had to have emergency surgery on September 14th. Well, only one parent can stay. So his dad, Tori, stayed. So Tori stayed. He had to get swabbed. And so did our son, Isaiah. So Isaiah got swabbed. He was negative. Tori got swabbed and was positive.
Oh.
And so, but we were asymptomatic, And so then when we brought Isaiah home the next day, we both were like, oh my gosh, like it could just hit us like a lot, And so then I went and got and tested a couple of days later and tested positive, whatever. My job says it's their fault. It doesn't really matter either way. But now I have natural immunity.
Yeah.
So it was a really mild case of COVID. I'll be honest. I take vitamins. I'm healthy. I felt fine. I was up and moving all the time, but now I have natural immunity. So now in, today's climate, if they don't fire me today, I'm going in there tomorrow for sure. Like, hey, Bree, where were you? Oh, I had COVID. Oh man, how was it? It was totally fine. I actually just took my vitamins and stayed hydrated, and I'm cool. And now I have natural immunity. And I want to kind of invite those conversations from these vaccinated individuals about natural immunity and use it as like an educational platform, because
natural immunity does exist, and that there are factors that will determine,
and it's
your age is a big factor. Comorbidities are a big factor, like all of these things. My issue is whatever you choose is fine, but it's not a one size fits all. Like think about the clothes that say one size fits all. No, they don't.
Never works out.
They do not fit all. Okay. It's a very common thing, especially in women's clothing. One size fits all, big fat lie. And I just want to say that I would say that analogy applies also when it comes to your own personal healthcare.
Yeah, it does. I mean, like my grandma got the vaccine. That's totally fine. She's 70 something. She has like 2 of the 3 major comorbidities. Cool, grandma. I love it. Go for it. My dad got it. Him and I have open conversations. He got it because of his job. He was the one who complied and was like, they're messing with my money. I'm just going to get it. He's in his mid-50s. He was down for a day or 2, but whatever. My mom, mid-50s, doesn't want to get it. Also fine. It's just I feel like I'm in the age group that it's okay. And that needs to be respected.
Yeah. Yeah, for sure. And especially under 40 or especially under 30, even more so, your chances are good as long as you don't have other things in partnership with that, as opposed certain health conditions and weight and all that kind of stuff. But you started to kind of feel it. You started to feel the tension. Did you ever have to have a conversation with a supervisor or anything like that about where?
I had a very quick conversation via text message. And my supervisor is super awesome. Actually, he himself does not get the flu shot, but did get the vaccine, but is no games, So he just straight up was like, hey, this is the deadline. Let me know what your plan is for getting it. And I just said, I don't know what my plan is at this time. And that was literally it.
And he's just doing what is being required by the hospital. It's not anything that
personal.
Yeah. Or trying to manipulate or coerce or anything like that.
Yeah.
He's just the messenger.
Exactly. And I've been very grateful for that, because I have not been harassed by my superiors as some people have.
Okay. It's now the end of the month. Tomorrow, people are they're calling it possibly the great resignation or the great firing, depending on who you want to talk to. Right.
Sure.
Do you see any consequences that people who aren't in the healthcare industry haven't considered because of these mandates?
Yeah. I mean, I think patient care is being greatly compromised. And it's really simple too. I think people are getting burnt out in healthcare. So even if they've been complying with the mandates, people are changing departments. We had 13 resignations in the summertime while I was gone, the most they'd ever had, they said, just moving to different departments. They don't want to work in the emergency room anymore, even though they are vaccinated. So tangent here, but the shortages that they're saying are staffing shortages, right? Because people are moving. It's not because the beds aren't there. The beds, the equipment, all of the things that they need are there, but the staff is not because they're burnt out. So I think that for me.
Well, and just to not to interrupt you, but just if people read the articles as of lately, a lot of times they will say that, but it's kind of like a hidden word where they include like they're overwhelmed or the beds are full. And then they kind of throw in there because of that. It's also like in association with staffing. I can't remember exactly what the term is.
Finagle it.
Yeah. If you're not really thinking about it, you're just reading it quickly, which a lot of us scan our news now. We don't really read it. All you're seeing is that hospital beds are at capacity or the hospitals are overwhelmed, but there's really no consideration that it's not always necessarily the number of patients that's overwhelming them. It's because they're not sufficiently staffed.
Exactly. And so that's a problem. But I think for me, my personal opinion, the biggest problem is patient advocacy. So with this whole COVID thing, they've restricted visitors and you have to like be vaccinated if you want to come in, or you have to be a support person. You have to meet whatever the hospital's requirement is. I know, everybody knows that if they have to go into the emergency room, they want to be with their loved one, whoever that may be. It could be your
friend. Which I think is a normal human need.
Yeah.
You're nervous, you're scared, you want some support.
Right.
Imagine that.
Yeah. Wow. Weird. So people are, coming into hospitals in very like vulnerable situations, crisis at times, without anybody by their side. And so if you're not feeling that great, you want to be able to count on your husband to be like, hey, this is what's been going on, and advocate for you. And that's been taken away. And so I think.
And that affects patient care ultimately.
Absolutely. Because it's like, if your demented grandma comes in, they're going to allow a support person, with conditions, but it affects patient care because you're not getting the care that you're used to getting because it's just you in there. And then, you can say, oh, we'll call my husband. And then they're going to call whenever they have time. But again, they're short-staffed, right? So when do they have the time? Whereas like if my husband was in the emergency room, I'll hit the bell. Hey, he's in pain. Like we need something. Or you know what? He said this, but it's really this. Or, so it's just taking away that extra support system that people need. And I don't think people really get the consequences of that. Even, like, hey, should it be, there's rumors about like DNRs and being on vents and, medication concerns and nobody is there for you. And that really saddens me. That really, really saddens me. I think that some people don't think about that aspect.
Well, and I always try and give some people grace. Like if you're not in the industry and you're just getting information, you don't know, you think you're getting all the information, but whoever's reporting it, especially now, the news is through a filter of bias. So it may be cherry picked a little bit. And unfortunately, kind of that's where we have entered into that. A lot of times people will make fun. There is a contingent that will make fun of like, do your own research, but it's true. It's necessary.
Yeah.
You can't completely trust what you're being told because it's coming through some kind of filter of bias.
Exactly.
People who are supporting people either not getting health care or losing their jobs because they're not complying with the mandates aren't really thinking, I don't know, down the road, like in the future, what are the repercussions of these things? What are the repercussions of creating a second class and not, or advocating that people shouldn't be treated because they haven't complied with a mandate, or that people should lose their job because they haven't complied with a mandate?
Yeah. It's just crazy. I work in the emergency room, so I just speak on that, but it's like people come into the emergency room for doing dumb stuff all the time.
All the time.
You know what I mean? Like, so it's like, if we really came from a place of judgment, if we worked with judgment in our heart, we would maybe serve 20% of the people that came in there. You know what I mean? And whatever these,
like you did something stupid. Why should I waste my lunch break on you?
Right.
You know what I mean? Like it could be like that extreme,
Totally.
But,
and so it's like, you just don't judge, again, we're public servants. We're not here to judge. We're here to help you. You came in for help. I want to help you. Like I genuinely want to help you.
Have you experienced or seen a shift in that mindset? Like
Absolutely.
In the beginning, everybody's like helping. And now it's like, if you haven't jumped through this hoop or met these requirements, I don't think I should spend my time with you.
Yeah. I've heard doctors, nurses, my manager, my department manager say, that the unvaccinated make us angry. The unvaccinated make our lives harder, our jobs harder. I've heard doctors literally say, if you're not vaccinated, you're not part of the team, you're causing a problem. I've seen unvaccinated patients, COVID positive, and doctors just kind of really voice their annoyance and how it's essentially their fault. So that's, me coming back from vacation until present day where I've seen that.
And has that sentiment been consistent? Because at the beginning we were told that even though these vaccines, which aren't really
a vaccine, it's not.
Yeah. They had a certain, depending on which one you want, had a certain percentage of efficacy, right? Mm-hmm. Which none of them were ever 100%. But at the same time, we were always told by the general media, get it to prevent the spread.
Sure.
The assumption being that if you're vaccinated, you can't spread it.
Right.
But then ultimately, a few months back, news came out that, yes, you can spread it. It just lessens the possibility of you ending up in the hospital.
Right.
So has that sentiment stayed consistent through all of these different changes and all of this different evolution, should we say, of the science that we've been told? Do you understand? Like, where they villainized from the beginning? Is villainized that's not a fair word. I shouldn't say.
Like, were the unvaccinated villainized?
Yeah, I could maybe. And I'm trying to give like a benefit of the doubt. This is me. I used to work with attorneys. I'm a double advocates type.
There you go.
So even though I don't agree with it, maybe in the beginning, if you're clearly being told this group will prevent it and this group doesn't, and this group is definitely spreading it and making it worse, then you can kind of maybe, I won't agree with it, but I could be like, I can maybe see your logic there. But then as the information changes and it becomes like group A and B can spread it. And in fact, group A probably has a higher load and more contagious, even though it may not be as deadly or whatever you want to, like, don't quote me on the science here. But the point is that they're still both spreading it.
Yeah. So I think in my job only, in my experience, it was not villainized in the beginning. Like, it wasn't like, if you didn't get the vaccine, it's like a problem. It's just like, oh, why didn't you get it? Like, I thought you would get it. And it was very casual and very cool. And when the mandates hit, that's when it became this whole division, right? Of right or wrong. And so I do have a handful of super cool coworkers that I love and have honest conversations about. And we would chat back and forth. And I think it went from get the vaccine to protect other people, right? As if it was my duty to protect other people. And then, once some information came out, it was, well, now it's for yourself too, right? So it's other people and yourself. So that's so great. And then my argument was like, why do you care if I choose to take the risk of being deathly ill? You know what I mean? Like, why do you care? And then it was like, well, you just don't want to end up in the hospital because then you're going to overcrowd the hospitals, right? That was the narrative for a while. Jump to present day, there's no narrative. It's like, if you're unvaccinated,
because they're firing people and they're creating the shortage.
And it's, if you're unvaccinated, you are the villain. And so I've had some conversations too about, like, I had to get tested these past like 6 to 8 weeks, right? Because I'm unvaccinated. And I'm like, oh, I'm going to go get tested. I'm like, oh, you're not vaccinated. And I'm like, no, but I was like, why don't you get tested? Like, why don't you go get tested too?
Yeah. Cause you can also have it.
Yeah.
And spread it.
And people at my job, at least, accept that and know that. And so there's just no conversations like, yeah, I know it's kind of weird, And so
would you say there's like a slow drip of conditioning where you hear it enough, like in the beginning, or you did the right thing? So I wonder this, is it because like you did the right thing, so you're being rewarded with not being tested? Is that even like a conscious or subconscious thing?
I think that they just don't know. It's definitely some conditioning, that you're so great because you got vaccinated. But I think that they did these things and they could have been right. I mean, this is all a huge experiment. The things that they put in place, they could have been right, but they're just not. So they had a 50-50 chance. You're right or wrong. Okay, you're wrong. And so I think people, at least at my hospital, are catching on to the fact that it's not what it's all cracked up to be. But they're also on that pedestal of, I still did the right thing. I can't wait to get my booster. Everybody should be vaccinated, And so it's a very strange balance, which I think is why if for some reason they don't get fired today, I'm excited to say, I have natural immunity and see what they say, because it's just, it's an experiment.
Yeah. It's like a bowl that keeps getting the holes and then it's turned into a colander and now everything is just, like you just can't hold it anymore. You can't hold the narrative anymore. Yeah. There's too many holes.
Yeah.
Now it is the end of the month, and probably by the time people are hearing this podcast, 2 weeks have gone by since this, but it's the end of the month. You might have to go in and be told, did you go through any kind of exercise or process of, this is my line, these are the consequences I'm ready to take on, and if I get fired, do you have a community around you? Do you have a plan to kind of help you, to support you and continue to live your life free as you choose?
Yeah, exactly. So I was obsessing over that for a while. What's it going to be like when they pull me into HR or their office and tell me I'm terminated? Because I've never been fired. Like if you looked at my record right now, it's amazing. I've never been in trouble, my entire life. I've been working for 20 years. It's nothing, so I don't have a line. I think my line, I just, I'm a believer in the Lord, of course. And so I'll go out with grace and just be like, okay. And I'll make sure I get on a piece of paper, for whatever that's worth. But that's it. I don't have a line. I have accepted it. It's fine. It's okay. I am supported for sure by my friends and my family. Thankfully, I'm very thankful to have that. And I do some marketing and wellness education on the side that has now really become my primary stream of income, thankfully, so it's going to allow us to get out of California and be free and live unrestricted, so I'm very thankful for that. Really, my ducks have aligned, if you would say. So I feel very loved and very supported. And that's what's really, I think, helped me be content. I woke up very anxious. I didn't sleep last night because I'm like, oh my gosh, today's the day. But that's, I feel like just a very natural thing to feel given the circumstances, but I'm ready. If I walk into work tomorrow and they're like, okay, you're done. All right, cool.
You're like, well, okay,
thanks.
I got other things to do.
Yeah.
Well, and it was funny because I spoke with, I did an interview. The first episode, it was with a friend of mine. Her name is Tiffany Poe, and she is this amazing, go-getter and does all this stuff. And she has I lose count. I think she has 6 kids, if I'm not mistaken. And then the pandemic happened and lost everything because she was in the, what do you call it? The hospitality.
Oh
business.
Yeah. That was hit hard.
So everything gets shut down. And she ultimately, she shares the story in there, how she took that opportunity to kind of be quiet. And we've all been confronted with either moments of quiet or moments where we feel like we're being forced to make a choice. It can be a stressful situation. I'm not going to minimize that, but I always try to be positive and look at things in the positives of this situation. What aspects of it can I take control of? And so she took that opportunity and came to realize I've been running this rat race because society tells me as a woman, I need to be all of these things. I got to be a mom and a business owner and take on all of this load and just be boss babe, which don't even get me started on that phrase.
I know it.
You know what I mean?
We'll use it for
that
now.
whole thing. And then when she got quiet and everything shut down, she's like, wait a minute, is this really what I even want? Like she discovered that she actually wanted more time with her family.
Yeah, that's me.
And so now she's kind of setting things up where she's able to run a business, but it's in conjunction with her family and spend more time with her family.
Yeah.
Like, have you gone through any kind of process?
Absolutely.
Like that?
Yeah. That's what this pandemic, I know it's, negative to the general public, but I've loved it for exactly what you just said. It's really given me that quiet time to figure out what it is that I want. Like when I said I didn't overwork and I used my PTO, and some days PTOs were mental health days, it was just whatever. So I really took this entire time, from probably the beginning of April 2020 until present day to sit down with myself and figure out what it is, because I think with these mandates, they didn't happen quickly, but kind of, and so things are just like, bam, 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 bam. And then it's like, I actually don't feel valued here. I love going to work. I love helping people. I love working in the emergency room. Before emergency room, I worked inpatient psych. I love it. But if you can just let me go, and I got notice of this mandate, I don't know, sometime in August, right? If you can just let me go in 4 to 6 weeks after all of these years that I've invested in you, you don't value me the way that I should be valued. And I'm only really going to get that right now in my life by staying home and sitting down and being quiet with myself and figuring out what I want to do. So when our son broke his arm, I didn't have work, right? That was amazing. I went straight to the playground and picked him up at the bottom of the slide and took him to the emergency room. I didn't have to go to my boss and say, hey, can I go? My son fell, and take 25 minutes to get there. I was at home. I was able, we spent the night. I went back and forth. I love cooking dinner. I love helping with homework. You know what I mean? Like the whole boss babe.
The whole boss babe thing is personified by media, and you're kind of conditioned to be like, yeah, that's what I want. But
my definition of boss babe is like, be home, be there for your family, cook some dinner, financially contribute. That's what I want to do. I want to just be available. I want to be that kind of boss babe, And so that's totally my vibe right now. And I love it. And I think just from my Instagram and speaking with people, a lot of people are on that same thought process. And I think it's amazing. And it's really turned what could potentially be a negative thing into something very positive. Because I'll be honest, when I say that, if I wasn't facing this mandate, I would have likely never sat down with myself and got quiet and realized that, and been forced really to do something that I'm meant to do. And so it's a silver lining. It's a blessing. It's backfiring on them, however you want to look at it. I'm so thankful. I'm really, really thankful.
And I think that goes a lot into you as an individual and anyone who is experiencing anything like this, whether or not they're going to take on a victim or victim mentality.
Yeah.
Like, are you going to look at this and see this as, this is happening to me and it's all of these other people's fault, be it anyone who isn't, whatever you want to categorize them, because they're not wearing masks or following mandates or staying home or whatever. It's all of their fault. And that's more of a victim mentality instead of taking personal responsibility, controlling what you can, and then assessing what is best for you as an individual, as opposed to what society or media is telling you you should be doing, what is actually valued by society.
Yeah. Because they're feeding people as if they don't have any control. A year and a half ago, you had control. You have almost that same control. You might be limited in some aspects outside of your home, but inside of your home, your life, whatever you want to do, the control is the same. You still have control. And so people are waking up to that idea, and I love it.
Yeah. It's been really interesting to see. I was actually talking about this with, I run a women's community online, and we have a Zoom meeting every 2 weeks. And we were actually having this discussion about how it's been interesting to see some predominant people start to wake up and be like, does anybody not see this? Like the whole Nicki Minaj thing, like all of a sudden, like, I'm not a fan. I don't follow her music. I don't think I've listened to the music since like the 90s, if I'm honest.
Shout out to her. Yeah.
But she starts saying like, do you not see this? And that's 22 million people that start to wake up to it.
Yeah.
Russell Brand just recently said something and is like, I was wrong. Stuff is crazy.
Yeah.
And so it has been interesting. They're a little late to the game, which is fine.
We'll take it.
You know what I mean? Better late than never.
Yeah.
We don't have to agree on everything, but there are things that we can join together. Like we may not agree on, I don't know, what's the best way to spend government revenue or whatever, but we can at least agree on we need to have freedom of speech and medical freedom and just freedom as a principle in general.
Exactly.
So
I love it.
We can come together on those things and then we can fight about the rest once we kind of get that situation under control.
Let's unite first with the mandates, please.
Exactly. Which is interesting because, you know, of course, this administration came on with this whole idea of unification, which I called BS from day one, but whatever. And then with these mandates, with you sharing your story, it almost becomes clear that the mandates have definitely been a tool or an item that has accelerated the division. It's not making it better.
Right.
Like,
I think it's going to be better though. I think it accelerated it.
Yeah. I am not a hopeless.
Right.
I am realist is what I would say. Yeah. I don't want to say I'm a pessimist. I'm definitely a realist with some like suspicion, like hope for the best, prepare for the worst mentality. So just to wrap us up, there's several people that have experienced this recently. Any kind of words of advice or encouragement that you would give them as they're maybe facing a choice of what to do? Just from your own personal experience?
Words of advice. I mean, the first thing that comes to my mind, honestly, is turn off your TV, love your neighbor, and sit down quietly with yourself. I think that's what's really served me. It's that simple.
Those are valid. I'm always like, I go along the same lines and I'm like, and find yourself a community. Find yourself like a small group of people that will support you and that maybe doesn't agree with you all the time, but will be respectful of your decisions and at least align with you on your values, on your core values.
Yeah. And stand up.
You can have the same values and not agree on everything.
Yeah.
So
I think people really need to stop suppressing their voice. There are questions that everybody has, on both sides, vaccinated and unvaccinated. They have questions, and they don't really suppress them. I'm a believer that conflict creates community. So if there's somebody that, doesn't have the same belief, they can still be a part of your community. Have that conversation, be strong, maybe you just find one person and you have that conversation to see their thought process and, open their eyes to your thought process. I just think that people have felt like they've lost control. And so they have kind of shut down their voices. And I think that's really sad. And it takes away some power from people. But as people gain their power back, I think it's going to be a really, really great thing.
That's really awesome. Well, I'm going to leave it there because those were some really good words.
Cool. Thanks.
And where can everyone find you if they want to follow you and support you?
Sure. Yeah. So my main platform is Instagram. It's @spiced_Bree with 2 E's _latte. Has nothing to do with coffee, but I just like the name. So that's where you can find me.
I will be sure to have the links down in the show notes so they can follow you.
Awesome.
And thank you so much for spending your time and having this. This was a good conversation. I really enjoyed it.
Yeah, I appreciate you so much. Thanks for reaching out.
Thanks so much for listening to It's Meseidy, honest conversations for freedom-minded women. You can find the show notes for this episode at Libertas Sisters /It's Meseidy. And if you would like to have conversations like this with other freedom-minded women, visit my website, libertassisters.com, an online community of women founded on the values of femininity, self-reliance, and freedom. You can also connect with me on Instagram @itsmeseidy or join my email list. And if you're loving the podcast, I would be so honored if you would go ahead and hit that subscribe button and leave me a 5-star review. Until next time, stay free and stay honest.